Diagnostic testing is extremely important in today's world because we are now at a stage where we can understand and identify genetic causes for individual developmental disabilities where we in the old days would just not know.
With current genetic testing technologies, we're able to identify an underlying genetic cause in almost half or 50% of children with global developmental delay or intellectual disability.
Not only can we potentially treat these cases, but also we will be able to provide prognostic information, how these individuals will do in the future. We will be able to change their overall management based on things that they may be at risk that they have not yet developed today.
Many times for a child with developmental delay, there is an underlying genetic cause, and there's many different genetic causes, too many to count, and probably many we don't even know. It can be important to figure out if there is a genetic cause and what that is, because it can affect a child's management, and also there can be other benefits for the child and for the family. So for example, some genetic disorders affect more than just development. The disorder could affect other parts of the body like the heart or the kidneys, things that we wouldn't otherwise anticipate. And so if we identify that a child has a genetic disorder that can affect those other body systems, we might recommend that we keep an eye on those body systems. So have an evaluation of the heart or of the kidneys. If we know there are specific health problems that are more likely in the future, we could recommend screening or evaluations for that.
Many parents often ask whether or not they should get a genetic test for their child. Even though a child's been diagnosed with a developmental disorder, oftentimes the genetic testing can be very beneficial for a number of reasons. One is it can help us more accurately explain the cause of that developmental disorder. So even though a child has a diagnosis of a developmental disorder, sometimes we're left wondering as to why. So genetic testing can be very important to help us identify the exact cause of that developmental disorder. Secondly, doing genetic testing, even though a child's been diagnosed with a developmental disorder, can be helpful because it can give us some indication of prognosis. So if a child has a specific genetic disorder, then we can better identify maybe that child's long-term outcome. Parents are often wondering, what's my child going to be like as an adult? What types of services are they going to need? What type of help or support are they going to need? And that genetic testing can be very critical to help us identify a long-term outcome for that child.
Lineagen has chosen to focus its First Step DX Plus testing option around chromosomal microarray technology, CMA technology. The reason we've chosen this particular genetic test among the hundreds of available genetic tests is because this service is now a guideline recommendation by several medical organizations. For example, in 2010, the American College of Medical Genetics recommended CMA instead of karyotype for children with certain developmental disabilities. In addition to this ACMG guideline recommendation, the American Academy of Pediatrics began recommending CMA as a first-line genetic test in August of 2014 for patients with developmental delay and intellectual disability. And we use a cheek swab or a buccal sample for our CMA testing. The cheek swab is very similar actually to the way a child might have his or her teeth brushed.
Donors should not eat, drink, smoke, or chew gum for 30 minutes before collecting a sample. Place sponge as far back in the mouth as comfortable. Caution should be used when inserting sponge into mouth to avoid choking. Rub along lower gums in a back and forth motion. Gently rub 10 times in total. Repeat rubbing motion on opposite side along lower gums for another 10 times. Unscrew the blue cap from the tube without touching the sponge. Turn the cap upside down. Insert the sponge into the tube and close cap tightly. Invert the capped tube and shake vigorously 10 times.
There are a number of misconceptions about developmental delay and genetic workup that we encounter with families. One misconception is that if there's nothing in the family history, then it can't be genetic. Often there isn't anything in the family history, meaning there's no other affected individuals. The child is the first in the family to have developmental concerns. A family history could be negative because the genetic change is new in the child, or because it's inherited in such a way that other family members are carriers but don't show symptoms themselves. One misconception is that it's never covered by insurance, and that's not true. Genetic testing frequently is covered by insurance, although there may be requirements and hoops you have to jump through, and those can be frustrating or difficult. But if you meet those requirements, or if you just even figure out what those requirements are, you'll find that often it is covered.
At Lineagen, we've solved that problem by putting together a team of insurance reimbursement specialists whose sole job is to help families through this process. From the initial pre-authorization request form through appeals or any other request from the insurer, our team is working to expedite those requests to get you and your patients answers sooner so the testing can be administered in a timely fashion. Lineagen is the only lab that provides this additional level of insurance reimbursement work on your behalf.